Today we will discuss about the mandibular nerve. In this cadaver, we already dissected the mandibular nerve. We already remove the left side of the half of the mandibles, and we have dissected the inferior nerve. First of all, the mandibular nerve, which is emerging, come out from the foramen oval. This is a foramen oval, and it is emerging out from the foramen oval. There are four structures which is emerging from the foramen oval. It is the mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. This is the just behind to the posterolateral to the foramen oval. There is a foramen spinosum. It passes the meningeal branch of mandibular nerve, posterior division of middle meningeal vein, and middle meningeal artery. These are the structure which is uh, passes through the foramen spinosum. So today we will discuss about the mandibular nerve, and it passes through the foramen. It come out from the foramen oval just lateral to the this lateral pterygoid plate. On the outer aspect, you can see there is a foramen oval. Now I will reflect the skin and of the head and neck region, as well as we have already dissected and remove the most of the structures, like this is a sternocleidomastoid muscles, and this one is the portions of the parotid gland. These are the deep cervical fascia and platysma muscles. Along with it, we will remove it and we will reflect it on the side. And here we have already removed the half mandibulectomy, and we have removed this one is the masseter muscles, and just covering by the masseters, by the fascia covering to the parotid glands and around to it, we have reflected the masseter muscles, and you can see here uh, we have removed the half of the mandible, and inside this mandibular foramen, here you can see in this foramen there is an inferior nerve which is passes. Before it gives the nerve to myloid. So inferior nerve, along with it there is a blood vessels, inferior vessels, which is the branch of maxillary artery, and inferior nerve which is emerging. It enter inside the mandibular foramen. It enter inside the mandibular foramen. Before it enter, it gives the branch. It is the nerve to myloid. So first of all, we will discuss about, we will find out the mandibular nerve. So here you can see this one is the posterior division of mandibular nerve, and this one is the anterior division of the mandibular nerve. So this mandibular nerve which is divide, here we have already removed the lateral pterygoid muscles. So this one is the posterior division of mandibular nerve, and this one is the anterior division of mandibular nerve. So anterior and posterior division of the mandibular nerve, and the trunk which is have a two part which is just come out whenever it come out through the foramen oval. It is called the trunk, and trunk which is have a, it gives the two branches. One, it gives the nerve to medial pterygoid, and another is the meningeal branch. Nerve to medial pterygoid, which is goes just medially, and it supplies to the inside the pterygoid fossa. There is a medial pterygoid muscles, and this nerve to medial pterygoid supplies to the medial pterygoid, as well as it supplies to, here we have already removed the medial pterygoid at that place, and just medial to this there is a one medial mandibular nerve. There is a another muscles. It is the tensor veli palatini, and there is another is the levator veli palatini, but here you can see there is a tensor veli palatini, easily you can see. So both these muscles which is innervated by the nerve to medial pterygoid. Medial nerve to medial pterygoid, it is a branch of the trunk of mandibular nerve, and it is goes medially and it innervate to the medial pterygoid. It gives the tensor veli palatini and levator veli palatini. Another branch of the trunk of the mandibular nerve which is emerging from the foramen oval. It goes again into the foramen spinosum. It enters inside the cranium through the foramen spinosum, and it supplies to the meninges of the middle cranial fossa by the nerve to spinosum. So the trunk of the mandibular nerve gives the two branches, nerve to medial pterygoids and nervous spinosum. It is also called the meningeal branch of mandibular nerve. First of all, I forget there is a trunk of the mandibular nerve have a two part, sensory part which is formed by the coming from the trigeminal ganglion, and motor part which is coming from the pons, and both are united, just come out through the foramen oval. Now we will discuss about, first of all we will discuss the posterior division of the mandibular nerve. So I pick up this posterior division, and first of all you can see this is the first nerve. It is a lingual nerve, which is the lingual nerve which is goes first branch of the posterior division, and it goes medially above to the submandibular glands, and which is gives the, here it is a lingual nerve which is relay inside the submandibular gland. How the fibers of the submandibular gland which is come through the lingual nerve. First of all I will show you on the medial aspect of the posterior division. Here you can see this one nerve which is called the chorda tympani. This chorda tympani nerve, just this one is the chorda tympani nerve which is united to the lingual nerve from the posteromedial aspect, and this chorda tympani nerve which is the actually branch of facial nerve which come out through the superior salivary nucleus. Superior salivary nucleus. So the fibers which is coming from the superior salivary nucleus, it is the emerging from the pons, the facial nerve which is emerging from the pons, and it gives the, at the middle ear, at the geniculate ganglion, it gives the one branch by the facial nerve and pituotympanic fissures, the chorda tympani nerve, which is enter inside the middle ear, and inside the middle ear it through the chorda tympani nerve, which is enter inside the uh, norma basalis through the pituotympanic fissures, and it along with this lingual nerve united, and the fiber which is relay inside the submandibular ganglion, and which is postganglionic fibers which is parasympathetic supplies to the submandibular gland and sublingual glands. So here you can see this one is the lingual nerve, and it makes the submandibular ganglion. This submandibular ganglion, which is the postganglionic fiber which is innervate to the submandibular gland, as well as here there is a small gland at that area, it is the sublingual glands. So both are innervated by the fiber which is relay inside the submandibular ganglion. It is topographically it is related with the mandibular nerve, but functionally it is related with the facial nerve. So here you can see this lingual nerve which is combined with the chorda tympani nerve. Just I will again show you the chorda tympani nerve. This is the chorda tympani nerve, and this chorda tympani nerve which is united with the lingual nerve, and so that's why propagally this lingual nerve which is related with the submandibular gland, and the functionally it is related with the facial nerve. Another nerve branch of the posterior division of the mandibular nerve, it is the auriculotemporal inferior nerve. This is the inferior nerve. So this inferior nerve which is lies inside the mandible. So inside the mandible you can see there is a uh, It enter inside the inferior nerve, enter inside the mandibular canal, mandibular foramen. It gives the branches to the molar and premolar tooth. After that, it gives the branches to the incisive and canine tooth, and after that it come out through the mental foramen, and it supplies to the skin around to the lower part in anterior part and this area of the mandible, which is innervated skin by the submental nerve. So this is the inferior nerve, and this come out through the mental foramen, then it is called the mental nerve. It supplies the skin of that area of the face over the mandibles, which is innervated by the inferior nerve. So inferior nerve gives the branches. It is to the premolar and molar tooth. It gives branches to the incisive and canine teeth, and then it gives sensory to the lower part of the mandibular area. Inferior nerve also gives, before it enter inside the mandibular foramen, it gives the nerve to myloid. This is nerve to myloid, and this nerve to myloid, which is innervate to the myloid muscles. This is the myloid head muscles, and this one is the anterior belly of digastric. So this both muscles, which is innervated by the nerve to myloid, and this nerve to myloid, it is the branch of inferior nerve. Another nerve of the posterior division of mandibular nerve, it is the auriculotemporal nerve. This is the auriculotemporal nerve anterior part, and this one is the posterior part of auriculotemporal nerve. And in between, you can see there is a one artery. This is the middle meningeal artery. So middle meningeal artery, which is passes here, you can see it passes through the between the anterior and posterior division of auriculotemporal nerve. Then it makes the trunk of the auriculotemporal nerve, and this trunk of the auriculotemporal nerve, after that it gives the many branches, and it is innervate to the one articular branches which supplies to the TM joint, articular branches which supplies to the TM joint in this area. Another branches which is given to the temporal branches, and it supplies to the skin over the temporal area, as well as it gives the tragus of the ear, as well as upper part of pinna and tympanic membrane, which is supplied by the auricular branch of the uh, auriculotemporal nerves. And so we already discussed this auriculotemporal nerve, and this auriculotemporal nerve supplies to the auricular part, which supplies to the skin of the tragus, upper part of the pinna, external acoustic meatus and tympanic membrane, and temporal part, which is supplies to the uh, skin over the temporal region, as well as it topographically this nerve, auriculotemporal nerve, which is concerned with the mandibular nerve, but this auriculotemporal nerve on the medial aspect of the mandibular nerve, here it makes the otic ganglion. So this otic ganglion, there is a fiber of which is relay of the glossopharyngeal nerve. We will discuss, and I will show you in book. It is difficult to show in dissection. Here you can see the fiber of the inferior salivary nucleus. It is come along with the glossopharyngeal nerve, and this glossopharyngeal nerve, it gives the inside the middle ear, it gives the one tympanic branch. Around to the promontory, it makes a tympanic plexus. After that, it gives the lesser petrosal nerve, and this lesser petrosal nerve come out through the foramen oval and relay inside the otic ganglion and the postganglionic fiber along with the auriculotemporal nerve, and it supplies to the secretomotor fibers to the parotid glands. It is a parasympathetic fiber, while the sympathetic fibers which is coming from the T1, and it is relay inside the superior cervical ganglion, and postganglionic fibers along with the middle meningeal artery, which innervate without relay inside the otic ganglion. It supplies to the parotid gland. Now we will discuss about the anterior division of the mandibular nerve. Here the first branch, here you can see this is the first branch. It is the mesenteric nerve along with the mesenteric vessels. It supplies to the inner aspect of the masseter. This nerve which is come out through the mesenteric this mandibular notch, and it supplies to the masseter from deep to the masseter muscles. Another nerve, it is the inner weight, it is the nerve to lateral pterygoid. This is the nerve to lateral pterygoid, which is, we already removed the lateral pterygoid, so this portion, it is the nerve to lateral pterygoid. Another branch is, it is the deep temporal, which is 2 in number. This deep temporal, which is innervate to the temporalis muscles. And last one, the sensory branch of the anterior division of the mandibular nerve, it is the buccal nerve. This is the buccal nerve. Here you can see this buccal nerve, which is uh, deep to the mucosa, and it innervate to the mandibular portions of the cheek and gum, which is sensory innervated by these buccal nerves. So anterior division, there is a 4 nerve. One is the sensory, it is a buccal nerve, and remaining 3 are the muscular branches. One is the nerve to lateral pterygoid, another is the deep temporal, there are 2 in number, and mesenteric nerve, it is the supplies to the masseters. And the posterior division, mainly it gives the 3 branches. It is the lingual, it is gives the inferior, and inferior also gives the nerve to myloid, and the third one is the auriculotemporal, characteristic around, wind around to the middle meningeal artery. And these are the 3 nerve, major nerve are the sensory, are the posterior division of mandibular nerve, and 2 nerve which is coming from the trunk of the mandible. It is the um, a nerve to medial pterygoid and nervus spinosum. It is a meningeal. It is also considered as a meningeal branch of mandibular nerve. So this is about to the we have discussed the mandibular nerve, and it is concerned, the mandibular nerve mainly concerned with the 2 uh, parasympathetic ganglion. One is the otic ganglion, which is lies just medial to the mandibular nerve and between the tensor veli palatini, and it is mainly concerned with the parotid gland. Another which is the concern, it is the another ganglion, it is the submandibular ganglion, and it is the topographically it is concerned with the lingual nerve, but functionally it is considered with the facial nerve. This is the fiber of this nerve, it is the submandibular ganglion. This is the lingual nerve, and it is concerned with the secretomotor fiber to the submandibular and sublingual glands. Hope you understand the lecture of the mandibular nerve. Thank you.